Hi everyone, welcome back to the pharmaceutical lectures. Today's lecture is pharmaceutical dosage form and their classification. I am Dr. Bibu Prasad Panda. Welcome you all to this online lecture, and this online lecture is proudly sponsored by Gold Pharmacy under the philanthropic vision of quality pharmacy education for all. And today's lecture is pharmaceutical dosage form and their classifications. So the dosage forms. Dosage forms are the means by which the drug molecules are delivered to the site of the action within the body. So, dosage forms basically is a carrier system by which the drug or active pharmaceutical ingredient will be delivered to the site of the action. What is the purpose of this dosage form? The purpose is to accurately deliver the drug and dosing of the drug and protection from the gastric juice. The drug or API has to be get protected from the gastric environment, masking the taste and the odor of the drug, and sustain or control or delayed drug release profile can be achieved by modifying or adjusting or designing a dosage form. Similarly, increase the optimal drug action by delivering or designing a suitable dosage form. Similarly, increase the drug delivery and the process for delivery of the drug into an appropriate site of administration, such as from inserting into the body cavities, topical application, all this feasible by making a different dosage form. So the dosage forms can be classified based on the route of administration, such as like oral delivery through oral route, or a topical, or a rectal, or a parenteral, or a vaginal, or inhaled, ophthalmic, otis, etc. Similarly, the it also can be classified as a solid, semi-solid, liquid dosage form. So we will discuss in detail about the classification and with a suitable example of the dosage form for better understanding of this dosage form. As I said, the dosage forms can be classified into two way or many way, but majorly we can say that based on the route of administration like oral, topical, rectal, parenteral, vaginal, inhaled, ophthalmic or OTC, otic going to be or going to be physical such as solid, semi-solid or liquid dosage form. Coming to the oral dosage form, the first one is the tablet. Tablet considered to be a solid dosage form containing one or more medicinal substance with added pharmaceutical ingredients. Among the pharmaceutical ingredients used in making of the tablets are diluents, disintegrants, colorants, binders, coating. Many ingredients, many excipients are used in making of the tablet. Mostly the tablets are hard, compressed solid mass containing the medicament in the shape of round, oval, square, and many shapes can be possible by making the designing of this dosage form. Coming to this making of this dosage form of the tablet, mostly we use the punches and dies of various size and shape to get the varieties of size and shape of tablet dosage form. And by this, we can able to make surface marking. We can able to make different sizes and shapes of the tablet dosage form. As I said, mostly the tablets are considered to be most common and more popular dosage form among all. The example is many examples will be there in the tablet dosage form like coated, entry-coated, non-coated, uncoated or film coated tablet dosage form. Example one example here is entry coated aspirin is a tablet dosage form. The next one is buccal or sublingual tablet. Sublingual and buccal medications are administered by placing them in the mouth, either under the tongue, then we call it as a sublingual, or between the gum and the cheek, considered to be buccal drug delivery system or dosage form. The medication dissolve rapidly and are absorbed through the mucous membrane of the mouth where they enter into the systemic circulation or bloodstream. So this is how is more popular the dosage form because this dosage form can bypass the GI system or gastric environment or enzymatic environment of stomach. So can be prevented the metabolism or enzymatic degradation of the drug by delivering the drug through the sublingual or buccal delivery. Example of this is the vasodilators, steroidal hormones can be possibly delivered through the buccal or sublingual. Even quicker action nitroglycerides also can be delivered. Next part is the effervescent tablet. Under the tablet, we are discussing under the tablet different types of the tablet where the one of the commonest, most convenient way of delivery of the dosage form is the effervescent tablet. It is a uncoated tablet that generally contain acid and base, and acids can be citric acid or tartaric acid, and base could be carbonated or bicarbonate agents, and they are react rapidly in presence of the water and releasing the carbon dioxide. When acid and base react in presence of the water, they deliver the carbon dioxide, and the release of the carbon dioxide assist or increase the disintegration of the tablet and making of the tablet into disintegrated into a dissolve or a dispersed system in water. Because of this mechanism, this delivery system or this dosage form provide a rapid tablet dispersion on dissolution, pleasant tasting by presence of a carbonated drinking. An example is effervescent antacid tablet. Coming to the next is the chewable tablet. They are chewed before swallowing or before engulfing. It has to be chewed by oral cavity. They are designed for administration to the children, to the adult, elderly patient who has a difficulty in swallowing whole tablet. In that case, normally advisable to go for a chewable tablet. Most commonly available is the chewable vitamin C tablets. Coming to the capsule, the second most popular oral solid dosage form is the capsules. Capsules are considered to be medications which generally encapsulated in a gelatin or a suitable inert container where the drug or drug with excipient will be dispensed. Mostly, these capsules are used to mask the bitter taste or unpleasant taste of the drugs. Mostly, capsules are used to get the palatability of the medicaments. There are two types of the capsules available. We call hard gelatin capsule, soft gelatin capsules. Hard gelatin cells capsules which are normally used for the dry powder ingredients. Example is amoxicillin capsule, and the soft cell capsules primarily used for oils or active ingredients that are dissolved or suspended in a oil in general. Example is fish oil soft gelatin capsule. Next is the lozenges. Lozenges, it is a solid preparation containing of high sugar polymers and the gums that later give the strengthen to the dosage form and the cohesiveness to these lozenges and facilitating a slow release of the medicament. So the lozenge is keep on suckling in the mouth and it slowly keep on releasing the medicaments. It is used to medicate the mouth or throat for the slow and administrative indigestion or cough remedies. Basically, these medications are generally localized action will be expected due to this slow release of these medications and mostly used in the mouth or throat medications. The example is throat lozenges like strepsils and Mostly, this is used for any localized accents on the throat or oral cavity. The next one is pastils. They are solid medicated preparation designed to dissolve slowly in the mouth. They are softer than the lozenges and their bases either glycerol or gelatin or acacia and sugar together. So these are the lozenges smoother than the lozenges, and this is called pastils. This is also expected to produce some localized actions in the throat and oral cavity. The example, throat lozenges like strepsils also can possibly can be prepared. Pastils. Next is the dental cones. The dental cones, these are also considered to be a tablet shape or intended to place in the empty socket following a tooth extractions for preventing the local multiplications of pathogenic bacteria associated with tooth extractions. They are cone. The cones can contain antibiotic or antiseptic medicaments. Powders. There are two kinds of the powder intended for internal use. They can be considered as a bulk powder. Bulk powders are basically a multi-dose preparation consisting of solid, loose, dry particles of varying degrees of fineness. They contain one or more active ingredients with or without excipients, and if necessary, coloring matters and flavoring agents or excipient can be added. Bulk powders usually contain non-potent medicaments such as antacids, since the patient has to measure the dose by using a volume or using a measuring medication medicated spoons or measuring systems. The powder is then usually dispersed in water, or in case of the effervescent powder, it will be dissolved and then will be taken through oral route. Example, antacid powders. Another category of the powder is called divided powders. They are single dose presentations of the powder, for example, small sachets that are intended to be used by the patient, such as to be taken with or with water. Example, sachets of oral rehydration salts. Liquid preparations. Oral solutions, basically, they are clear liquid preparations used for the oral application, and they contain one or more active ingredients along with some inactive ingredients or vehicles or a excipients and suitable vehicles. Basically, example is the syrups, the cough syrups, or next part is the oral emulsions. Oral emulsions are stabilized oil in water dispersion. Either or both the phases drug can be dissolved or dispersed. Example, cod liver oil emulsion. Next is oral suspension. Oral suspensions are liquid preparation for oral use containing one or more active ingredients suspended in a suitable vehicle. Oral suspension may show a sediment which readily disperse on sucking to give a uniform suspension which remains sufficiently stable to enable the correct dose to be delivered. Example, amoxicillin suspension. So basically the suspensions are biphasic systems where the drug will be dispersed, where emulsion also considered to be a biphasic system where oil and water or water in oil type of system is considered to be a oral emulsions. So solutions, emulsions, suspensions all comes under the liquid preparations. Then syrups. Syrups are concentrated aqueous solutions of the sugars, usually considered to be sucrose or fructose. The flavored syrups are a convenient form of masking the disagreeable taste. So, high concentrated syrups are used to mask the bitter taste or mask the disagreeable taste of the medicaments and the excipients. Example is the simple syrup used as a vehicle for medications. Elixirs, it is also considered to be a liquid preparation. It is having a pleasant flavored, clear, liquid oral preparation of potent or nauseous drugs. The vehicle may contain high proportion of ethanols or sucrose or together with antimicrobial and preservatives, which confers the stability of the preparations. Example example is phenobarbital elixir. Linctus are the viscous liquid oral preparation that are usually prescribed for the relief of the cough is considered to be linctus. They usually contain high proportion of syrups and the glycerol which have demolitions effect on the membrane of the throat. The dose volumes is small, mostly around 5 ml, and to be prolonged, the demolition action they should be taken as a undiluted way. Example, cough linctus. So under the liquid preparations, another two category we are going to discuss is the gargles and mouth washes. The gargles, they are aqueous solution containing which prevent the or treat the throat infections. Usually they prepare with having high concentration solution with the direction for the patient to dilute with warm water before use gargles. Similarly, the mouthwash, these are similar to gargles, but they are used for oral hygiene and treat the infection of the mouth. Example, antiseptic mouthwash like Listerine will be the suitable example of mouthwash. Ointment. Ointments are semi-solid, greasy preparations for application to the skin, rectum, and nasal mucosa. The basic the base is usually anhydrous and immiscible with skin secretions. Ointments may be used as an emollient or to apply suspended or dissolved medicaments to the skin. Example is hydrocortisone ointment. Now, coming to the topical dosage form, this ointment, cream, they are considered to be a semi-solid dosage forms. Creams are semi-solid emulsions, that is mixture of oil and water. Oil in water type of cream which are composed of small droplets of the oil dispersed in a continuous aqueous phase. Oil in water creams are more comfortable and cosmetically acceptable as they are less greasy and more easily washed off using water. Example, moisturizing cream like Eucerin. Then water in oil, the creams are composed of small droplets of water dispersed in a continuous oil phase. Water in oil creams are more difficult to handle, but many drugs which are incorporated into the cream are hydrophobic and will be released more readily from a water in oil cream than oil in water cream. Example is cold cream. Gels or jellies under the topical dosage form. Gels are the semi-solid system in which liquid phase is constrained in a polymeric matrix consisting of a natural or a synthetic gums. The polymers or the polymeric matrix could be either natural or a synthetic gums having high degree of physical chemical cross-linking. They are used for medications, lubrication, some miscellaneous applications like carriers for spermicidal agents to be used intravaginally. Example, the gels are is aloe vera gels can be used or considered as gels. Paste, these are also considered to be semi-solid and topical dosage forms. Pastes are basically ointment into which high percentage of insoluble solid has been added. Pastes are less penetrating, less macerating, less heating than the ointment. Pastes make particularly good protective barrier when placed on the skin. The solid contained can be absorbed, thereby neutralize certain noxious chemicals before they ever reach to the skin. Pastes are less greasy because of the absorption of the fluid hydrocarbon fraction to the particulates. Example, zinc oxide paste. Under the topical dosage form, transdermal patches. Transdermal patches or skin patches is a medicated adhesive patch that is placed on the skin to deliver a specific dose of medication through the skin and into the bloodstream. So transdermal patches are going to place over the skin, which going to deliver the drug to systemic circulation or going to make a delivery of the drug to the bloodstream. The advantages of transdermal drug delivery system is over the oral is the topicals as, they provide a controlled drug release medication to the patient and also it can bypass the gastric environment. So these are the benefit why we go over the transdermal patches over the or transdermal patches over the oral delivery because it's going to produce a prolonged delivery or a controlled release or going to avoid the degradation by GI system or gastric or enzymatic degradation of the drug by this dosage form. The first commercial available patches is scopolamine used for motion sickness and, one of the another example is nicotine patches. Under the topical dosage form, liniments and lotions. Liniments are the fluid or semi-fluid preparation intended for application to the skin. They may be alcoholic or oily solution or a emulsion. Most they are massaged into the skin to produce a counter irritant. Liniments should not be applied to the broken or a broken skin or broken open wounds. Example, Mengai pain relief liniments. Lotions, these are the fluid preparation, basically aqueous for external application without friction. They are either dabbed onto the skin or applied on a suitable dressing and covered with a waterproof dressing to reduce the evaporation. Example, calamine lotion. Next one is collodions. Collodions is a solution of nitrocellulose in either it is in ether or acetone or sometimes with addition of alcohol the colloidants are prepared. Its generic name is pyroxylene solution. It is highly flammable. As the solvent evaporates, it dries to a celluloid like films over the application area. Compound what remove consists of acetic acid and salicylic acid in an acetone colloidance base used for treatment of warts and keratolysis. Example, compound what removers. Next is the rectal dosage forms. They are also considered to be semi-solid dosage forms. It is under semi-solid medicated mass, usually cone shaped, that are inserted either into the rectum, it's called rectal suppositories. If it is inserted into the vaginal, then it's called vaginal suppositories or pessaries, where it is melt at the body temperature. It can be prepared with the lipid base which melt at body temperature. Example, cocoa butters used in making of suppositories. Another example of this is glycerin suppositories. Enema. So this is medication used for the rectal dosage forms, and enema is the procedure of introducing a liquid into the rectum and colon via anus is called enema. There are two types enemas are there. Evacuant enemas used as a bowel stimulant to treat the constipation. Example, soft soap enema or magnesium sulfate enema. The volume of the evacuant enemas may reach up to 2 liters. Retention enema, the volume does not exceed more than 100 ml, may exert a local effect. Example is the barium enema used as a contrast substance in the radiological imaging of the bowel system. Coming to the next is the pessaries. This is used for vaginal dosage form. The pessaries are solid medicated preparation designed to insert into the vagina where they melt or dissolve. Molded pessaries, they are cone shaped, prepared in a similar way to molded suppositories. Example, clotrimazole pessaries for yeast infection. Compressed pessaries, they are made in a varieties of shapes and are prepared by compression in a similar manner to the oral tablet. The next one is vaginal capsules are similar to soft gelatin capsule differing only in the size and the shape. Example, vaginal progesterone capsules. Under the vaginal dosage forms, the vaginal rings. The vaginal rings are donut-shaped polymeric drug delivery device designed to provide a controlled release of drug to the vagina over a extended periods of time. Several vaginal rings products are currently available, including hammering a low-dose estradiol acetate release ring manufactured from silicone elastomers for the relief of hot flashes and vaginal atrophy associated with menopause. Similarly, Nuava rings are a low-dose contraceptive vaginal ring releasing progesterone and estrogen. Example, vaginal progesterone capsules. Pessaries. Next is inhaled dosage form. The inhaled doses or inhalers are solution or a suspension or emulsions. I would like to emphasize that solutions are single monophagic, suspensions or emulsions are biphagic system where the drugs in a mixture of inert propellant held under a pressure in an aerosol dispenser. Release of the doses of the medicaments in the form of droplets of 50 micrometer diameter or less from the container through a spring-loaded valve incorporating a metering device. The patient then inhales the released drug through the mouthpiece. It is commonly used to treat the asthma and other respiratory problems. Example, albuterol inhaler used for asthma or asthma. A nebulizer is a device used to administer the medication to the people in form of a liquid mist to the airways. It's commonly used to treating the asthma or asthma and other respiratory diseases. It forms air, oxygen through the liquid medicines to turn into a vapor, which is then inhaled by the patient. As a general rule, generally physicians prefer to prescribe inhaler over the nebulizer because they are easily and cheaper and portable and less side effects. Nebulizers for that reason usually reserved only for serious case of respiratory diseases such as severe attacks of asthma or respiratory diseases. Example, salbutamol solution for nebulizer. Nasal drops and the sprays. Drug in solution may be instilled into the nose from a dropper or from a plastic squeeze bottles. The drug may have a local effect like antihistamines or decongestants. Alternatively, drug may be absorbed through the nasal mucosa to exert a systemic effect of the drug. The use of oily nasal drops should be avoided because possibly it damages the cilia of the nasal mucosa, which allow the drug to transport. So mostly it's oily preparations are avoided. Example, oxymetazoline nasal spray. Eardrop. Eardrops are solutions or suspension or emulsions of the drugs that are instilled into the ear with a dropper. It is used to treat or prevent the ear infection, especially infection of the outer ear or ear canal. Example, ciprofloxacin eardrops. Now we are going to discuss about the parenteral dosage forms. So parenteral means parenteral is other than or out of the enteral means other than the oral delivery system or GI system is called to be parenteral. But this is the earlier definition. But nowadays the parenteral dosage forms are administered by injection through the skin or the external boundary of tissues rather than through the digestive tract and reaching to the systemic circulation is called parenteral dosage form. Example, we have intravenous injection where the drug is directly injected through intravenous route to the bloodstream. Example, IV antibiotics like vancomycins can be administered direct to intravenously for the systemic effect of the antibiotic. Intramuscular injections are those preparation which are administered to the muscles and through this delivery system. Mostly we can able to make a sustained or delayed prolonged delivery systems like used in the vaccines like flu shots. Subcutaneous injections are administered into the tissues layer between the skin and the muscles, and the example is insulin injections used for the diabetic patients. Intradermal injections administered into the dermis just below the epidermis of the skin. Then example is tuberculosis skin test. Normally we use this to understand the how the reactions are going to be tuberculosis. That is basically a intradermal injections. Intrathecal injections are administered into the spinal canal or spinal cord's root. Example, chemotherapy drugs for certain types of cancer. It is advisable to go for the spinal delivery or spinal canal delivery. Epidural injections. Epidural are injected into the epidural space around the spinal cord, and they are basically helpful in reducing the pain during the labor and is morely commonly used in this delivery system. So this is a brief note on this dosage forms. If you have any questions on this PowerPoint or in the lecture, feel free to put a questions or discussion in our YouTube presentations under the comment section. You can also like, share and subscribe our lecture. So Thank you very much for your support and encouragement. Again, you can contact me through my mail ID called could be vivuprasad25 yahoo.co.in. Thank you once again for your support and encouragement. Hopefully, look, we will be produced many series of pharmaceutical lecture in coming days and in the future. Thank you very much. Thank you for your support and cooperation.